Hello, everybody. My name is Jacqueline Williams, and today I will be doing a presentation on congestive heart failure. What is congestive heart failure? It is a chronic progressive condition in which the heart's function as a pump is inadequate to meet the body's needs. More specifically, it refers to the stage in which fluid builds up within the heart and causes it to pump inefficiently. The heart fails to meet the needs of tissues and organs such as the brain, the liver, and the kidneys. This image shows two hearts, a normal heart with normal ventricular chambers and a congestive heart with thickening of the ventricular chambers and smaller filling capacity and ejection of blood. Next, let's talk about the epidemiology of congestive heart failure. This is a very common and growing fatal condition. Based on current studies in the United States, more than 3 million adults have evidence of this disease, and more than 400,000 new cases occur each year. In the US, Canada, Western Europe, and Japan combined, the estimated number of patients with this failure exceeds more than 10 million. In addition, it is the most common cardiovascular discharge diagnosis in the elderly patients. In fact, listed as a primary diagnosis in hospital discharge records in 1990, accounting for more than 5 million hospital days and 8 billion in expenditures in diagnostic procedures and prescription medications. Aside from hypertension, heart failure is the leading cardiovascular cause for outpatient doctor visits. Despite considerable advances in the diagnosis and treatment, associated mortality rates still remain very high. This image here is a graph that represents the percent of female and female population impacted by congestive heart failure. It is based on age. The blue represents the male population, while the red represents the female population. We can clearly recognize that the population impacted the most is definitely in our elderly, ranging between the ages of 60 and 80 years old. I found it interesting to see that in the range from 60 to 79, the range that was affected the most was the male population. However, in the 80 and over range, it was the female population that was impacted at the end. Next, I wanted to talk about this image here. It is heart failure in America is becoming a silent epidemic. It is clearly a common and growing and fatal condition, quickly spreading, not only in just our country, but worldwide. It is important to stop and wonder why these rates are going so much highly, these mortality rates, and what can we do as Americans to reverse the high mortality rates? Further, let's talk about the history of congestive heart failure. It was believed for several centuries that the purpose of the heart was to distribute heat throughout the body by pumping air, and failed to see any connection to edema, dyspnea, or anasarca. In the 17th century, William Harvey was able to accurately describe the role of the heart in circulation, which provided early insight into the etiology of congestive heart failure. He observed that a dilated ventricle was associated with the disease. The significance of cardiac muscle dilation was not appreciated until the breakthrough work of E.H. Starling with the law of the heart in the 1910s. Every first-year medical student learns about Starling's law, his notion that as end diastolic volume increases, cardiac performance increases to a point. Starling predicted that dilation to a point increased cardiac function, but after a certain point, it would weaken the heart. In the late 1980s, scientists began to view heart failure as a syndrome or a constellation of symptoms due to dysfunction of several organ systems, rather than a disease confined only to the heart. Following, we're going to cover the pathophysiology of congestive heart failure. This is a syndrome that can be caused by a variety of abnormalities, including the pressure and volume overload, loss of muscle, primary muscle disease, or excessive peripheral demands, such as high output failure. In the usual form of heart failure, the heart muscle has reduced contractility. This produces a reduction in cardiac output, which then becomes inadequate to meet the peripheral demands of the body. The four primary determinants of left ventricular performance are generally altered as follows. First, there is an intrinsic decrease in muscle contractility. Next, there's a preload or left atrial filling pressure is increased, resulting in pulmonary congestion and dyspnea. Although systemic blood pressure is often reduced, there is an increase in systemic vascular resistance, which can further reduce cardiac output. Heart rate is also generally increased as part of a compensatory mechanism associated with an increase in sympathetic tone and circulation catecholamines. In patients with coronary disease, there is often an imbalance between myocardial oxygen supply and demand. An increase in heart size may be particularly destructive by increasing wall tension and increasing myocardial oxygen consumption. Following, I wanted to take a moment here and talk about the function of the heart itself. The heart is always working hard and pumping blood through a network of blood vessels called arteries and veins. If the heart cannot efficiently pump the blood to the organs and tissues of the body, it will then be incapable of meeting the needs of these organs and tissues. It will not be able to provide the adequate nutrients and oxygens needed for these organs and tissues to properly function. As a consequence, this will impair the function of important organs such as the brain, the liver, and the kidneys. This will impact dramatically our overall health. The blood flow process in the heart and body are as follows. The right side of the heart pumps blood to the lungs, while the left side pumps blood to the rest of the body. Blood from the body enters the right atrium through the vena cava. It then flows into the right ventricle, where it is pumped to the lungs through the pulmonary artery, which carries the oxygenated blood to the lungs. In the lungs, oxygen is loaded onto red blood cells and returns to the left atrium of the heart via the pulmonary veins. Blood then flows into the left ventricle, where it is pumped to the organs and tissues of the body. Oxygen is downloaded from red blood cells into the various organs, while carbon dioxide, a waste product of metabolism, is added to be removed in the lungs. Blood then returns to the right atrium, and the cycle starts all over again. We continue to talk about right heart failure, left heart failure, or both. The left heart failure occurs when the left ventricle cannot pump blood to the body and fluid backs up and leaks into the lungs, causing shortness of breath, cough, congestion, fatigue, to mention a few. This image on the top represents a heart showing how the effects and impacts of the heart when it's being affected by left heart failure. The right heart failure occurs when the right ventricle cannot adequately pump blood to the lungs. Blood and fluid may back up into the veins that deliver blood to the heart through the vena cava. This can cause fluid to leak into tissues and organs. Back pressure in capillary blood vessels causes them to leak water into space between cells. Gravity causes fluid to accumulate in the feet and ankles. Fluid can also accumulate within the liver, causing it to swell, and within the abdominal cavity. Hepatomegaly may make the patient feel bloated, nauseated, and have abdominal pain with the feeling of distension. Depending upon their underlying illness and the clinical situation, patients may have symptoms of right heart failure, left heart failure, or both. It is important to know that both sides of the heart may fail to function adequately at the same time, and this is called biventricular heart failure. This often occurs since the most common cause of right heart failure is left heart failure. Again, on the top image, you can see there's the impacts of the heart being affected when it goes through right heart failure. Those are the effects there. On the bottom, we can appreciate two patients suffering from left side failure and right heart failure. It describes the signs and symptoms that they will be going through as the progression of the disease occurs. Next, we're going to talk specifically about the signs and symptoms of the disease. First, noticeable symptoms are fatigue, swelling in your ankles, feet, and legs, weight gain, and increased need to urinate, especially at night. The next are symptoms that indicate the condition has worsened. There's an irregular heartbeat, a cough that develops from congested lungs, wheezing, and including shortness of breath, which may indicate pulmonary edema. The symptoms that show the condition has worsened is chest pain that radiates through the upper body, rapid breathing, skin that appears blue, which is due to the lack of oxygen, and fainting. We continue to talk about the causes of congested heart failure. There are many disease processes that can impair the pumping efficiency of the heart to cause this disease. In the United States, the most common causes of congestive heart failure are coronary artery disease, high blood pressure, diabetes, valvular heart disease, severe emphysema, and cardiac arrhythmia. The less common causes of this disease also include viral infections of the stiffening of the heart muscle, thyroid disorders, and heart rhythm abnormalities. Here next, we talk about the stages of the congestive heart failure. It is very often that it's broken down into 4 stages, ranging from an initial high risk of developing heart failure to advanced heart failure. In the early stages, the heart muscle stretches and develops more muscle mass, thereby contracting with more force to pump more blood. After a period of time, the heart enlarges and cannot manage its workload, which leads to fatigue, shortness of breath, increased heart rate, leg swelling, and other symptoms. The stages for these patients are as follows. Class 1, these are patients without limitation of physical activity. Class 2 are patients with slight limitation of physical capacity, in which marked increase in physical activity leads to immediate fatigue, palpitations, dyspnea, or angina pain. They are comfortable at rest, though. Class 3 patients are patients with marked limitation of physical activity, in which minimal ordinary activity results in fatigue, palpitation, dyspnea, or angina pain. They are still comfortable at rest. Lastly, class 4 patients. These are patients who are not only unable to carry on any physical activity without discomfort, but also have symptoms of heart failure or the angina syndrome even at rest. The patient discomfort increases if any physical activity is undertaken. We continue to learn if there are factors that can increase your risk for developing this disease. Sure, they are. The following are things we can do to help increase the risk and avoid doing these things. Excessive alcohol consumption, obesity, smoking, long-term use of anabolic steroids, and lack of exercise. Important is to know what procedures and tests diagnose this condition. Diagnosis is based on the knowledge of the particular individual, their medical history and a careful physical examination and selected lab work. Common tests include the following. There's an electrocardiogram, EKG, ECG to help assess heart rate, rhythm, and indirectly the size of the ventricles and blood flow to the heart muscle. Chest x-rays, which we can see the image here, to look at heart size and the pressure or absence of fluid in the lungs. This x-ray shows there's a lot of fluid buildup in the lungs. Blood tests may include a complete blood count, electrolytes, glucose, and creatinine to assess the kidney function. Echocardiography or ultrasound testing of the heart is often recommended to assess the anatomy and the function of the heart. Other tests may be considered depending upon the clinical situation of the patient. We talked further here about the treatment for treating this disease. The goal of the treatment is to have the heart beat more efficiently so that it can meet the energy needs of your body. Overall, it is focusing on reducing the symptoms and preventing the progression of the disease. It also requires treatment for the underlying cause of the failure, whether it be an infection, a heart disorder, or a chronic inflammatory disease. The treatment will be largely directed by the staging of the CHF and may involve lifestyle changes, medications, implanted devices, including heart surgery. Some of the common medications given to these patients include ACE inhibitors or ARBs. These are medicines that are also shown to increase survival by decreasing the systemic resistance and favorable altering the hormonal milieu, which affects the cardiac performance. Beta blockers may control heart rate and increase cardiac output and ejection fraction and provide beneficial response to circulating epinephrine. Digoxin is an alternative medicine. It's an older medication that may help increase cardiac output and control the symptoms. Lastly, there's medication to decrease body fluids, which are usually known as diuretics. Spironolactone is a very mild neurodiuretic, which has shown to be of long-term benefit to the patient. We continue here, equally important to talk about lastly, the prognosis and life expectancy for these patients. Prognosis depends on the stage and the cause, the patient's age, severity of the heart failure, and severity of the underlying heart disease impacts the patient's prognosis. Numerous factors may affect a person's survival rate, including age, sex, exercise tolerance, and other medical conditions. The prognosis is broken down into increments of 5-year mortality rates, an assessment that estimates short and long-term survival rates from the time of a person's diagnosis and treatment. Despite considerable advances in drug therapy and cardiac assist devices, the diagnosis and treatment of heart failure associated mortality rates remain high. Perhaps more strikingly, congestive heart failure is the only major cardiovascular disorder that is increasing in incidence, prevalence, and overall mortality. There's a rapidly increasing number because of the aging population. However, when congestive heart failure develops suddenly and has a treatable underlying cause, patients can sometimes return to normal heart function after treatment. Although the prognosis for heart failure may be unnerving, there are numerous lifestyle changes and medications that can help slow down the progression of the condition and increase your chances of survival. You can be proactive in managing the condition by monitoring your symptoms. It is possible to reverse this disease. You can do it by eliminating unhealthy habits such as smoking, exercising regularly, eating a healthy diet by eliminating fats, refined sugars, and processed foods, reducing our stress levels, and maintaining an appropriate 7 to 8 hours of sleep for healthy arteries, and also regularly keeping up with your doctor visits. With appropriate treatment, even individuals who develop congestive heart failure as a result of long-standing heart disease can often enjoy many years of a productive life. This concludes my presentation for today. I hope you learned something new about congestive heart failure, some of the signs and symptoms, and most important, what we can do to prevent this disease. Thank you for watching, everybody.